When COVID-19 brought life as we know it to a halt in early 2020, the Desert Healthcare District and Foundation quickly responded. Its board and CEO, Conrado Barzaga, recognized it could help ensure that federally qualified health centers across the Coachella Valley received the personal protective equipment and other resources they needed to protect the community. In addition, the district's immediate allocation of $1.2 million in grants provided core operational support to help many nonprofit partners keep their doors open during the outbreak. Soon it was evident that COVID-19 was a full-fledged pandemic with an uncertain end date, and additional help was required. The Desert Healthcare District and Foundation turned to the Riverside County Department of Public Health to offer assistance in distributing resources to Coachella Valley residents. Supported with $1.2 million in CARES Act funds from the county, the district and foundation got to work identifying potential partners to fund and coordinate the implementation of a strategy. Since the late 1990s, when the Desert Healthcare District and Foundation's mission evolved from a hospital-centric organization to a community-focused district, our strategy has been centered on collaboration, which has always been an integral component. The Coachella Valley Equity Collaborative was formed in fall 2020, and grants were awarded to 8 community-based and faith-based organizations to coordinate a plan. District and county public health staff worked alongside these nonprofits to deliver educational resources and messaging, COVID-19 masks, tests, and other protective measures, and COVID-19 vaccines as soon as they were available. An important and necessary first step in the district's outreach was to prioritize Coachella Valley farm workers as essential workers. Like healthcare and other employers, the farms that employed these workers could not afford to shut down. Millions of people who were isolating across the U.S. were counting on the crops to feed their families. But the valley's thousands of farm workers were at risk of being exposed to COVID-19 and not receiving the protection they needed. That changed through the collaborative, which the New York Times identified in March 2021 as the first effort in the nation to include farm workers as essential workers.
At the onset of the COVID-19 pandemic, we realized that this was an emergency for the region, and we approached the county very early on and offered our help. We asked, what can we do? It was a very tumultuous time. It was difficult to make decisions because we didn't have enough information. It was so new and we were so unprepared. What we knew is that we had deep relationships in our community, and that we had community organizations that were ready to provide their support, to reach into the community and to offer help where it was very difficult to offer help because of the lack of infrastructure. The county saw that and they said, let's work together. How can we do this? And in fact, the Coachella Valley became a model that many people wanted to replicate. I think the main asset we had was that we had promotoras on the ground, and they were organized under different organizations, but they had in-depth knowledge of our community. And because of that, we were prepared to start helping our community. We had to pivot. We are a grant-making organization, and we had to pivot into a direct service organization, organizing this movement, organizing all the agencies that became the greatest asset for the entire county in delivering healthcare services where it was difficult to reach that population for a variety of reasons. The geographic isolation, the language barriers, the cultural barriers, and because they didn't have the flexibility of taking time off, working on Zoom or Zooming in to do the work. We realized that it was important to keep our community working in doing that.
During the 3 years since the COVID outbreak, the Coachella Valley Equity Collaborative has swelled from 8 initial partners to about 25 partners at various times, including public school districts, local and regional pharmacies, farm owners, and more.
The organizations we partner with were incredibly important in the COVID-19 response because they're all established in the community and they serve various target populations and communities ranging from youth to farm workers. This was crucial in ensuring we develop appropriate outreach and educational strategies specific to those communities. In addition, some of our community partners opened their doors and allowed us to use their facilities, including schools, churches, agricultural fields, and community centers, which made it possible for us to reduce barriers to access for community members and set up mobile COVID-19 testing and vaccination clinics.
In addition to allocating its own funds, the Healthcare District and Foundation received more than $3 million in grants from Riverside County Public Health and $725,000 from the Public Health Institute for the collaborative COVID response.
I remain eternally grateful. And I cannot emphasize enough how incredible the district work is in our valley. And it all starts with Desert Healthcare Districts and Foundation CEO, Dr. Conrado Barzaga. You see, Dr. Barzaga believes healthcare requires thinking outside the box. He believes in taking a patient-centered approach to addressing the social determinants of health and to create 21st century solutions for 21st century problems. Dr. Barzaga es un guerrero que lucha por la justicia social, por la equidad, por la salud, por las comunidades más necesitadas. Hemos trabajado juntos en el campo y he visto su corazón